Good evening, everyone. I'm going to call to order the Town of Harwich Board of Health meeting for Tuesday, November 19th, 2024, 6:34 p.m. Welcome. The first call to order is going to be the public comment. Do we have any public comments from anybody?
So we do have online Nicole Hallis from Crescendo. She's here to present our public health community needs assessment for the Lower Cape. Take it away, Nicole, if you want to share your screen. Oh, I don't think.
Absolutely.
Okay. We can hear you now.
Okay, perfect. All right, let me figure this out. All right, give me 1 second.
We're full of technical difficulties tonight, so.
Okay, should be here. Here. All right. Are you looking at a PowerPoint screen?
We sure are.
Okay, perfect. Let me get this started. I'm going to turn this on and get this started. All right, perfect. Well, thank you, everyone. Thank you for your patience. Good evening. My name is Nicole Hallis. I'm a research manager with Crescendo Consulting Group. And I've been invited here tonight to present the Community Health Needs Assessment completed for the Lower Cape region. What we're going to discuss tonight is an overview of the health needs assessment, including the overall goals and objectives, the methodology we used, review some key findings, hear voices from the community, and also look at the community survey results. And finally, we'll reveal what needs were identified during the assessment and what that means looking ahead for next steps. So let's start with a quick overview of what exactly this project was. So this community health needs assessment was completed by my research firm, Crescendo Consulting Group, in partnership with the Barnstable County Department of Health and Environment and the health departments of Brewster, Chatham, Harwich, and Orleans, which for the purposes of this assessment, we're calling the Lower Cape. In general, a community health needs assessment uses a variety of methods to look at health challenges and resource gaps in a specific area, with the overall intention of serving as a foundation that can use to be, plan and implement strategies to improve community health and well-being. And for this assessment, our overall goal was to gain a deeper understanding of the health and social challenges impacting residents on the Lower Cape. To achieve this goal, we had a few objectives in mind. First, we wanted to make sure that this assessment was as inclusive as possible to provide a well-rounded view of the issues. And second, we wanted to look at the issues that were common both across the region and in each town. And finally, we wanted to identify key needs and some actions and strategies to help address those needs. So that was a lot of information. So how did we go about achieving those goals and objectives? The methodology at a high level for this health needs assessment involved a blend of qualitative and quantitative research. And all that means is that we looked at both numbers and talked to people. So we analyzed secondary data, conducted stakeholder interviews, had focus group discussions, and we disseminated a community survey. This assessment also included an access audit, which was essentially a mystery shopper type test of service availability in the area. And finally, we completed a needs prioritization session with the health directors of the 4 towns. And to just give you a sense of the amount of data collected during this process to identify those community needs, this slide just shows a comprehensive list of all the data analyzed.
Nicole?
Each data source...
Can I stop you for a moment, Nicole?
Yeah, absolutely.
I feel like your information at this point has far exceeded those of us who are still looking at the Lower Cape Cod Community Health Needs Assessment slide. I feel like you're moving on to definitely now other slides. I wasn't quite sure for a minute, but
Okay.
Yeah, we're still on the.
Where would you like me
like
to?
your
Where would you
opening
like me to go
slide.
back to?
okay.
If you want to advance us to
As
where you
far as
are.
visually, we're on your opening slide.
Oh,
I'm listening intently, but
okay, so what slide are you looking at right now?
Still your opening.
Opening one.
Huh. Interesting. All right, let me stop sharing and try again. Thank you for calling that out.
I was wondering if she,
All right,
I didn't
let's
want to
try
cut you
this
off,
again.
but then
I was just about
I
to
got
say
to a point where I
something,
was
too.
like, all right.
yeah.
Yeah, no, I appreciate you calling that out. Let me try. All right, so I stopped sharing. Let's try this. Share my entire screen. Pull it up here.
And could it be?
Are you looking at a slide collected data?
Yes,
and
now
ca-
we are.
Can we make
Okay.
that a full screen? Because you can't read it.
Can you? Let's see. Hold on, let me try. That better.
It's not
I
needed.
present. If I do that,
go.
does that work?
That's a little better.
Okay. Well, I can certainly also send these slides after the fact so that you can see them. And I really apologize here. I can go back so that you can see what exactly.
Now, I think this is great if you want to just pick up where you are.
Okay, perfect. So to give you a sense of the amount of all the data that we collected during the process to identify community needs, this is the slide that shows a comprehensive list of all the data. So each data source here offers unique insights, and when combined, they create a holistic view of the community health needs. It helps to provide a clear understanding of the challenges and opportunities for improvement when we look at all of this information in totality. So the first thing that we're going to look at here is some of the key secondary data findings, which is the quantitative data portion of the assessment. That includes things like demographic data and health data obtained from public sources, so things like the census, regional, state, and national health sources, including the CDC, among some others. So looking at this quantitative number data helps to lay the foundation of needs and the environment that they exist in. First up, as I'm sure this will not be surprising to many of you, the secondary data shows that the Lower Cape has an aging population. Chatham and Orleans have the second and third highest median age in the entire state. It's important to understand those types of demographic trends because the age of a population directly influences the type of health services needed in the community. Understandably, an older population has unique needs and requires different services. Older adults are particularly impacted by social isolation, mobility, transportation issues, and are more likely to have chronic or complex health challenges that need screening and monitoring. To really highlight this point, nearly 1 in 10 adults aged 65 and older in the Lower Cape live alone. So older adults living alone are particularly vulnerable because they might be aging in place without a support network, which makes them susceptible to other issues like failing to keep regular doctor's appointments or be able to get out of the house to access food. The next finding that came out of this assessment shows that 6% of the population in Brewster and Harwich, and it's a little bit higher in Harwich, is 6.8%, they speak a language other than English at home. While almost 7% might seem like a small number, it signals a need for accessible multilingual services and the need for trusted community partners that can help build relationships with that part of the population. If someone can't access resources or services in their language, they're less likely to seek help, which can then cause compounding issues over time. The third finding is that housing costs are rising while the housing stock is decreasing. This is creating a host of challenges for people currently living and working in the community, and it's a barrier for people who may want to move or stay in the area. That has a direct impact on employment because workers, even in high-paying jobs like doctors, can't find or afford housing in the area. While many people think of the Cape as an idyllic vacation and retirement area, and it certainly is, the fourth key finding here is that while the Lower Cape towns are generally affluent, wealth disparities do exist both across and within each town. Within each individual town, there are pockets where the percent of the population living below the poverty level is much higher compared to the rest of the town. It might be a little hard to see on this map here, but this is a map of census tracts. The areas that are darker blue and kind of teal are areas with higher poverty, and you can see that some of those are surrounded by, lighter green and yellow, which represents less poverty. So you have these pockets of really concentrated poverty kind of sprinkled throughout this Lower Cape area. It's not necessarily surprising that there are these pockets that exist, especially considering that living wage for a 3-person family in Barnstable County is more than 3 times what the state minimum wage is. So what that means is someone working a minimum wage job is going to struggle with costs associated with things like housing, food, medical care, childcare, transportation, all of the things that are necessary for someone to live a well-rounded life. And wealth disparities make it really challenging for the part of the population with less money to access resources, putting them at risk for poor health outcomes and lack of community connection. The next finding relates to food insecurity, which has increased nearly 20% in the county since 2018. This is largely related to recent cost of living increases and generally high prices on the Cape. Cape Cod does have a very extensive network of food pantries, but access to those resources can be limited by barriers such as the lack of transportation. And if someone doesn't have access to healthy, nutritious food, they could end up dealing with health issues down the line. The final secondary data finding that I want to bring up here is directly related to health and the shortage of healthcare providers in the county. One of the most common themes that came up when speaking with community members during the assessment was the lack of healthcare providers, specifically primary care providers and mental health providers. Looking at the ratio of healthcare providers per person, Barnstable County does indeed have significantly fewer per person compared to the rest of the state. So looking at these numbers here, it's 1,130 people per 1 primary care provider. That's how we read those numbers compared to the state level. So Massachusetts, it's 627 people to 1 primary care provider. So it's really hard to access a primary care provider just because there's such a shortage of them. And that's true for all of these categories that are shown here. And without a medical home and an affordable, accessible way to get medical care, residents may delay or forego treatment, leading to worse health outcomes and increased reliance on emergency services. And we heard anecdotally during this process that emergency services are really serving as kind of a safety net for both unaddressed physical health and mental health issues. For mental health, this is especially important given that recently the number of suicides in Barnstable County rose by 48%, a rate higher than any other county in Massachusetts. And when looking at mental health providers, the difference between the state and the county level there isn't as stark as primary care providers, but we're still looking at 444 people for every 1 mental health care provider compared to the state level, which is 307. And these next couple slides I'm going to talk about include some direct quotes from community members on key topics that speak to more broad community needs that are still important for us to bring up, but they might not have necessarily been captured in the secondary data numbers. So this is really anecdotal themes that came up in our conversations. One major theme that community members directly spoke to was the stigma surrounding sensitive community issues, especially mental health and substance use. As one resident noted, people know issues with substance use exist, but stigma can prevent the community from really talking about the issues in a meaningful way, which then makes it hard to prevent them in the first place. Community members also raised the fact that nearly everyone in this community has been affected or knows someone that has been affected by substance use, but because nobody talks about it, it's really hard to deal with those root causes. And I included this here because it highlights the need for comprehensive community education and outreach to help reduce some of that stigma, and also encourage residents to access services and get the help that they might need. Community education would also be beneficial for the general public to increase empathy and understand what others are going through. And also just general community education would help the people who are struggling learn more about what resources do exist. This next slide calls out feedback from community members on what they see as the importance of community connection. Many residents expressed a desire for more accessible, engaging gathering spaces that don't require spending money for both teens and adults. There are a lot of activities and things to do, but if someone can't afford them, then they can't participate in those activities. One resident reflected on the isolation caused by the COVID-19 pandemic, calling for more free, inclusive events that can bring people of all ages together to really help foster a sense of belonging and community. So next up, we're going to discuss the key findings from the community survey that we disseminated as a part of this process. In total, 384 community members took the survey, which is a really excellent number and representation of the community. So first up, we asked residents what general health issues community members struggle with the most. The top three answers were primary care services, healthcare services for the elderly, and healthcare services for adults. This isn't necessarily surprising given the lack of healthcare providers in the county, and hearing what community members said in focus groups and interviews about the difficulties of finding a primary care doctor and the popularity of the concierge model of healthcare services that doesn't necessarily work for everyone. We also asked residents about what type of health screening and education programs they would like to see more of. So the top three answers were programs that encourage and facilitate healthy aging, programs for skin cancer screening, and programs for sun safety and awareness, all excellent programs to have that community members are looking for more of. And as a complement to health issues, community members were asked which general community issues residents struggle with the most. The top three answers were affordable housing, livable wage job opportunities, and affordable quality childcare. Both of those were over 75%. And again, this isn't surprising given the high cost of housing and general high cost of living in the area. Digging more into health, residents were asked what mental health and substance use programs the community needs, and those top three answers were counseling services for adults, counseling services for adolescents and children, and crisis or emergency care programs for mental health. This again goes back to the data showing the shortage of mental health providers and the mental health issues that have become more prevalent in the community. And again, I would just like to call out the fact that these are really high numbers. So more than 3/4 of all the respondents that took the survey identified these as something that the community is lacking, but it needs. underscoring this very important need for mental health and substance use treatment in the Lower Cape. Nearly 10% of survey respondents, so 1 in 10, reported having a family member with an unmet mental health or substance use need. Over half of the respondents shared that they themselves experienced depression or anxiety in the past 2 years. Additionally, and concerningly, half of respondents said they were unsure of where to actually seek help if they were having a mental health or substance use challenge. So that's a very real need in the community for mental health care and substance use care, and people don't know where to go to get help with that. Lastly, and particularly interesting for this meeting, the survey revealed that residents are generally unaware of what the town and county health departments are actually responsible for in the community. So only 2 in 5 survey respondents know what the local health department is responsible for. 1 in 3 know what the county health department is responsible for. Encouragingly, though, there does seem to be a desire in the community to learn more about the health departments and get them more involved. 3 in 4 survey respondents would like to learn more about the local and county health departments. So based on all of the information gathered from the health needs assessment, we aggregated the secondary data, the qualitative data, the community survey data, and we identified several top priority community needs and organized them into high-level categories. The first category here is community education. So community members expressed this strong desire for more information about available resources, learning about the local health departments, and also areas like substance use prevention and mental health services, learning more about what's available to them. And by improving education and outreach, residents can then be empowered to take control of their health and reduce stigma associated with needing help for those issues. The second category here is substance use. So the community identified both early intervention programs and treatment options for individuals in recovery as urgent needs. Notably, the Lower Cape does lack a substance use coalition, which other areas of Cape Cod have found beneficial in addressing some of the challenges through coordinated collective efforts. The third category here is mental health. So mental health services, particularly for crisis situations, were another key need highlighted during the assessment. Many residents shared that they were unaware of where to turn during a mental health emergency. Increasing access to crisis care, mental health counseling for all age groups is critical for supporting those who are struggling. The fourth category is general community well-being. To enhance community well-being, there needs to be a focus on developing programs that address issues like senior isolation and wellness education. Many of the seniors in the Cape are aging in place and face challenges without a robust support network. So programs that help support things like mental health literacy and healthy aging can have a positive impact. The fifth category is preventive health care. So as we talked about, the Lower Cape has a shortage of primary care physicians, and many residents struggle to access routine care. Expanding access to primary care, developing transportation options for medical appointments are key issues here that need to be addressed. And preventive health care also includes things like screening programs. So screening for things like chronic health conditions, cancer, mental health issues can help more serious issues from manifesting. The last area of concern is community infrastructure. So that includes affordable housing, accessible rental properties, reliable transportation options in general, not just healthcare appointments. Those are all critical needs that residents need those to live and work in the Lower Cape. Livable wage job opportunities also came up. Livable wage job opportunities also came up to help families achieve economic stability. And while these community infrastructure needs I recognize are largely outside the direct scope of the health department, there could be opportunities for collaboration in addressing some of those needs. So looking at the next steps, now that these needs have been identified, what happens with all of this information? So in this project, the needs were discussed with project leadership from the health departments. Each town's health department representative prioritized specific needs for their community. Common priorities, particularly in Harwich, included enhancing the presence of health departments, expanding substance use treatment and prevention programs, improving community health programs, and supporting accessible food initiatives. Based on those identified and prioritized needs, this health assessment includes a set of strategies and recommendations to address those key challenges. For example, establishing a community health hub or health and human services department would help centralize access and ease some of those barriers and issues. Another recommendation is also to launch a community-wide education campaign that can promote understanding of what it is the health department does. And one of the clear themes from this assessment is the importance of collaboration. Tackling these needs will require a collective effort between health and other town departments, community organizations, town leadership. So my role here was to help highlight the needs and provide a roadmap for moving forward. And the hope is that these insights can support, cohesive strategies to build a connected, stronger community. And looking ahead, it's evident that addressing this is a lot of community health needs. It's a lot. So addressing them all will take sustained effort and collaboration. No one department, agency, or even town can address all of those needs alone. But working together can help enact meaningful changes. And the Lower Cape and Harwich can build a healthier, more resilient community. It's definitely possible by working together to tackle, one of these things at a time. It doesn't all have to be done at once. But now that the information has been collected and identified, it's a starting point for moving forward. So thank you for your time and attention this evening. It's really been a privilege to work on this assessment and to support these towns of the Lower Cape understand their community health needs. If there are any questions or if you'd like me to send out this slide deck, I'd be happy to do so. My contact information is there. I'm sure you could also talk to Carrie if you have additional questions about this project. And thank you again so much for having me, and I apologize profusely for the technical issues at the beginning.
Oh, thank you, Nicole. Working with you was such a pleasure, and we're very lucky that we got you and your organization to conduct this survey for us, so thank you. Any questions from the board or input?
No, not at the moment.
If you wouldn't mind emailing me those slides, Nicole, so we could share those, that would be amazing. And the
Absolutely.
needs assessment is
Yeah.
up on our website as well, so if anybody wants to access the full report, there's a lot of compelling data in there that Nicole didn't get a chance to share, so.
As somebody who works in a primary care office, seeing the ratio versus the rest of the state was pretty interesting.
Yeah. When you see the numbers,
Yeah.
we all know the
I'm a math
issues, but when
person,
you
so
see the
like
numbers.
makes sense.
Well, thank you again, Nicole.
Thank you. Okay. All right, before we go any further, I just want, something that I should have said in the beginning. As required by law, the town may audio or video record the meeting, and any person intending to either audio or video this open session is required to inform the chair. So if anybody's doing that, please let me know. Thank you. Okay, all right, next on the agenda is the minutes. So the minutes for August, since I wasn't here, I did look them over. The only thing I can see on this, the call to order, you did say was me, and I wasn't here.
I wasn't here either.
Pardon?
Kevin.
So I guess,
It would've been
yeah,
Kevin.
Kevin.
Yeah, that was me.
Yeah, so that has to be changed, so we can't finalize.
It's all right,
this.
we can't vote on it anyway.
Yes,
We gotta have all, there's only 3 of us there that day. We
If there
gotta have-
is, yeah,
You have to have all 3 of us to approve it?
yeah, we need Pam here to approve
Right.
those.
but was there anything else that you saw?
So you can vote on the second set
Yeah,
for September.
so, all right. So, on the second set, I didn't see anything. Anybody else? All right, do I have a motion?
Motion to accept the minutes of the September 17th meeting.
Second, anybody?
Second?
Vote?
Aye.
Aye.
Aye? Aye.
Sorry.
Okay. All right. All right, now it's your turn.
Okay, new business. Reconsideration of existing variance conditions. 14 Parallel Street, request for approval of increase in square footage for proposed 18 by 16.3 inch porch addition.
Good evening.
Good evening.
Dan Croto from Moran Engineering. After all that information that was provided, I feel pretty minor here. But, the owners of 14 Parallel Street are looking to put in a screened porch. And the way the variances were written in 2001 requires approval through the board for any increase in the size of the house. Even though it's not habitable space, it's still an increase in the house size. The whole majority of the east side of the property is a wetland. On the plan I just show the, the closest border to the wetland. So they originally, when the septic was designed, they couldn't get 100 feet from the leaching area. And that created the variance requirement, and then the standard no additional square footage. As part of this approval, it had to go through conservation, which it went through and was approved. Conservation has a requirement that you take the increase in square footage and you have to double it, and you get rid of that much existing landscape area and let it naturalize. So there is an improvement environmentally along the edge of wetland for any surface runoff there's a new native buffer to the wetland. So hopefully it's seen as an improvement, and gives the homeowners a place in its existing lawn. We're looking to put this, and it gives them an area that not be bit by mosquitoes, basically. So I'll leave the presentation at that on this one.
Any questions from the board? Okay, I don't have any.
I move to approve the reconsideration of previously approved variance conditions for 14 Parallel Street with the following conditions. 1, the property is restricted to a maximum of 4 bedrooms. 2, no further increase in habitable space or square footage without further review by the Board of Health. 3, no garbage disposal is allowed. And 4, the conditions and approval shall be recorded at the Barnstable Registry of Deeds.
I'll second the motion.
Vote?
Aye.
Aye.
Aye?
Aye.
Okay,
Great, thank you.
thank you. Okay. Moving along.
Reconsiderations of existing variance conditions. 23 Ships Haven, request for approval of increase in square footage for proposed addition and renovation.
Good evening again. Dan Croto from Moran Engineering. This one's not as simple as the last one, and the proposal is, again, for a screen porch to the south, and then removing the garage, expanding the kitchen, and then above the garage, adding a bedroom. This one's interesting in that it was approved originally, so the original variances and approval was a 4-bedroom septic system, so the existing leaching area is 4-bedroom, existing septic, I should say, is 4-bedroom. And it was 4-bedroom. Since before these owners owned it, so the most recent septic inspection has it as 3-bedroom. One of the lower rooms was opened up as part of a rehab of the building in around 2017, I believe. There was a building permit pulled, and one of the rooms was opened up. So when the new septic inspection came out, it was actually 3 bedrooms. So now, the new proposal would add a bedroom. They're hoping to keep that lower room because the variances and the septic system is designed for 4 bedrooms. As part of the proposal, there's an old, the 97 septic system put in a new leaching area, but kept the original septic tank, which is very close to the wetland. Would not work today, but it worked back in 97, or permitting wise. So part of the proposal would be to remove that tank, which is very close to the wetland, and then put in a new 2,000-gallon monolithic tank, and also add an IA filter to reduce the nitrogen down to the 19 parts per million. So overall, a reduction in nitrogen, greatly increase the treatment. And then beyond that was, again, as I stated previously, we did go through conservation and got approved. The proposal got approved through them, and part of their requirement is the adding, so taking whatever increase in hardscape and building, and then doubling it, and then because it was so close to the wetland, they wanted even more, so it ended up being 800 square feet of mitigation, removing lawn and landscaped area along the edge of the marsh and replanting with native plants. So there's an increase in treatment of the wastewater flow, and an increase in treatment of the overland flow of stormwater running towards the wetland over the existing landscape lawn and stuff. So there is environmental improvements. Like I say, it's not as simple as the last one, but I'd like to hear if the board is acceptable to this, or if they need to do any changes to their proposal. But this is the way the owners would like to proceed forward.
And you said back in 2017, when there was a change to the house, one of the rooms, it was changed from 4 bedrooms to 3, and that change was part of that agreement, or, I mean,
It was just that the homeowners at that time, I believe that's just, it fit their needs to change it that way. So there's nothing that went through the board. But I believe the original approval was for 4 bedrooms, so now
Okay, so that wasn't anything that came through the board, it just happens to be 3 bedrooms now because people changed it on their own?
Yeah, but through a legal building permit, but yeah, it's nothing that came through the board at the time.
So no increase in habitable space or no expansion of the footprint was proposed at the time of the building permit, so it didn't require Board of Health approval, and we looked at it as they weren't increasing, they were just rehabbing and reconfiguring the floor plan and not asking for more bedrooms. They were actually going down in bedroom count, so.
It wasn't anything that we were there wasn't even a need for a new site plan at that time. That wasn't anything that I was a part of.
I have one other question. Under the option 2, I don't see anything here regarding a maintenance program for the IA system.
So, it would just be that an operation and maintenance agreement would be required, following all Board of Health requirements.
All right, okay, because that wasn't listed here, so just so that it's, but it would be.
Mhm.
All right,
And you can borrow it from this one if you want the language, so item C, the
From-
option to add IAs on that one.
oh, from C. Yeah, all right, no, wait.
Are
Okay,
we all in?
all right, so in other words, since they're looking at putting an IA system in, this would have to be included. Yeah, all right.
All right. I make a move to approve the reconsideration of previously approved variance conditions for 23 Shipshaven Road with the following conditions. 1, the property is restricted to a maximum of 4 bedrooms. 2, no further increase in habitable space or square footage without further review by the Board of Health. 3, no garbage disposal is allowed. 4, the conditions and approval shall be recorded at the Barnstable Registry of Deeds. And 5, a signed operation and maintenance agreement for the alternative system shall be submitted to the Health Department prior to the release of the disposal system construction permit. The O&M agreement for the alternative system shall include a requirement for testing. This testing shall be conducted in accordance with the Board of Health protocol.
Second that motion. Aye.
Aye.
Aye?
Aye.
Okay. Thank you. Okay. All right, we're up for number C.
Reconsideration of existing variance conditions, 19 Shannon Road, request for approval of increase in habitable square footage.
Good evening.
Board.
You want to just introduce yourself if you're going to speak?
I'm Gus de Alcantara, working for Elizabeth.
Mobasili, I own the home.
Okay.
As part of a project, we intend to increase the habitable space on the existing property at 19 Shannon by incorporating the existing garage, the footprint of the existing garage and breezeway, and squaring off on the front of the house and creating a bigger livable, common livable space in there, kitchen, living room, an extra bathroom, and a quiet room, music room. That would be one of the homeowner's wishes.
Mm-hmm.
It accommodates my daughter, she's special.
Mm-hmm. Okay.
Someplace that's not like a bedroom, but a place that she'd go out and be separate from her bedroom, but like in a place that's, you know, away from the noise in the kitchen and the boys and all of that. It's just for accommodation.
Where's that? All right, the only, why can't I find that drawing? So it looks like, this was a cross, or an easeway through here originally.
Breezeway,
Breezeway.
I guess,
All right.
It is too. Yeah.
It's the same, the house was built in 65, and literally nothing had been done to it probably since 65. My grandmother owned it. And then my cousin, who was a veteran, lived there until her death. And then by the time her daughter had notified me that I was the last person alive, basically, because my dad had already passed away, my aunt had passed away. At any rate, the water pipes froze, and, oh yeah. And so, it was a major January storm, but they didn't tell me that they didn't do anything about the oil tank. But anyway, so it became a disaster. And so it was a physical disaster, and it was a legal disaster because my maiden name was Hickey, my grandmother was Elizabeth Hickey. So there was a lot of confusion between Elizabeth B. Hickey, who passed away, and Elizabeth, no middle initial, Hickey, who was still alive, and now I'm married. So that confused a whole lot of things. So finally, when we finally got that together, it took a while. We thought that as conformity to the other neighbors in the neighborhood that took the design that they had had and made it so that their garage encompassed kind of, it made it look a little bit more sense. That's why we decided on this particular plan that you have. So it's one floor, it has 2 bedrooms, it has 1 bathroom, it has a garage that really doesn't serve much purpose. And then that breezeway right in the middle that all the wind and everything whips through, and snow piles up inside, and rain ends up getting in there. So the other neighbors were smart, and they had already done that. So I said, oh, that's a good idea. So hence is what you see there.
If you drive by on the street, every house looks the same,
They all look the same. Oh, except for mine. It's a disaster, so,
and the neighbor who's taking care of it.
yeah.
Okay, it appears as though, I guess with the door, based on our definition of a bedroom,
It's not yes, it's not a bedroom and there won't be a door. But actually, the one single door you see goes into dead center of the house.
So these are the floor plans that we have. We don't have the 5-foot cased opening. Absolutely, yeah. Thank you, because that will be,
We were told,
oh, okay, all right,
we don't have that in our packets.
all right, so that's,
We
What's
still
the
have the
change?
old.
'Cause I-
Yes.
I had the same question.
yeah, so they made it a 5.
All right, so that's the plate?
Yep.
I just think it just ended
Okay.
up not in the
Yep.
packet, so.
Yeah, so what they
Yeah,
did,
okay.
they, instead of this doorway that would make it a bedroom,
Yeah.
they did this, they made it, so it's no longer,
Locked it up.
Yeah.
Locked it up.
And if the board is going to approve it and wants to spell that out in the motion, just so it's clear that that's what you're approving, if that's the way you go.
so now, do they have to provide,
They'll have to, when we approve the building permit, we'll want that.
do we have to, does that have to be in this?
No, you can approve it based on this floor plan that
All right.
they're providing, and just,
Oh,
Do you want to keep that? Or
can they,
now I
in
can
the
provide
approval.
copies, I
It's already
can
on.
write copies.
yeah, you uploaded it to the building permit, correct?
Yeah,
Okay, so when we get to approving the building permit, that will
Would
be
be
the
on that one.
condition.
do you want
Yeah.
to keep this one?
If, yeah.
Building permit has the 5-foot.
All right,
You need this for your purposes,
No.
because we'll have a digital copy.
no, well, if you wanna keep that, I don't mind, I'll make sure that you have the right ones.
Paper can be expensive nowadays, so I don't,
Just so we know which one you're
yes.
approving.
Do you want that one too, Carrie?
I think I have
Copy?
that copy, yeah.
Okay.
oh, okay,
Thank you.
okay,
Any,
that was it.
I move to approve the reconsideration of previous variance conditions for 19 Shannon Road with the following conditions. The 5-foot cased opening be added to design, eliminating the space as a bedroom, which was already discussed. 2, the dwelling is restricted to a maximum of 2 bedrooms. 3, no further increase in habitable space or square footage without further review by the Board of Health. 4, no garbage disposal is allowed. And 5, the conditions and approval shall be recorded at Barnstable Registry of Deeds.
Second motion.
Okay,
Aye.
thank you.
Thank you very much.
You want to finish your vote?
Oh, yes, go ahead. Aye.
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 Okay.
Thank you
Thanks.
very much.
Okay.
So we'll have, just so you're aware of the
Do you
process.
wanna keep this nice color copy
Tomorrow,
if
I
you
will
need it for
draft a
future?
letter that will be mailed out, or you
That's
can
a
pick it
nice
up.
color copy. I
And
don't know
it
if you
needs to
guys
be
wanna keep
signed
that.
and
I
recorded by the
appreciate-
homeowners and brought to the registry of deeds, and then we can need the bills.
I don't feel I need it.
We don't need
I-
it. And she's got what she needs.
Thank you.
Absolutely. Okay, we'll call you when it's ready to be picked up. Okay? Yep, you're welcome. You're very welcome.
Thank you.
Good night.
B, request from Elder Services of Cape Cod and the Islands, waiver for food establishment license fee, $50.
They're a nonprofit, so they are requesting not to pay for their license fee, which
I think it makes sense.
Yeah.
absolutely
All
makes
right.
sense.
I move to approve the request from Elder Services of Cape Cod to waive the food establishment license fee.
Second it. Aye.
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 Okay.
Board of Health Director.
All right, so we have a lot of things that have been going on. We have a tobacco training tomorrow, so the board, when we were talking about tobacco regulations, had wanted us to do some outreach for our establishments and get some training for them. So Jen, our health inspector, has collaborated with Bob Collette at the Tobacco Control Division with Barnstable County and is doing a tobacco training session for the retailers. This training will cover essential topics including required signage, flavored product, regulations, local and state laws, underage sale prevention, and common violations. A Q&A session will follow to address any concerns, and retailers from nearby towns, Chatham, Orleans, Brewster, and Eastham are also invited. It will be held at the 204 in the, on November 20th, so this is tomorrow morning. And it's a valuable opportunity for our retailers, again, organized by our health inspector, Jen Singleton.
Is this going to address that update from the state where they were going to require?
Bob from the county is going to be there, and anything new that needs to be talked
But
about
they
with
were
our
gonna have to
retailers, we'll
start-
present to them, yeah.
Yeah, okay.
So it should absolutely adjust to your concerns with the age to card,
The carding,
yep.
yeah, which I,
Which is now changed to 30, I
30.
believe.
From-
So
what's
if
it,
you
what's
look
it, 27?
30 or younger, you should be carded.
Yeah, okay.
We also have our AmeriCorps member that has started, our service partner from AmeriCorps through Barnstable County, Emerson Odell. They are 22 years old, environmentalist, artist, and external learner. They recently graduated magna cum laude in Global Environmental Studies from Clark University in Worcester. They grew up in upstate New York, enjoying the woods and lakes near their home. They paint, draw, play guitar, and are an avid reader. They've worked with native plants in nurseries, farming, and landscaping. They love working outside and prioritize respectful stewardship of the land. They are thrilled about the opportunity to engage in restorative ecology work. Emrys will be researching and creating a garden plan for the People's Garden, as well as building our educational platform for next season in the garden. So Emrys brings a lot of extensive knowledge about gardening and planting. They've done some work in other gardens, so we're excited to be able to learn from Emrys and what they bring to the table for our garden. We also have our flu clinic that we hosted on October 3rd with the VNA. At the Harwich Community Center, the VNA reported that they vaccinated 45 adults and 2 kids for COVID. In addition, they administered 31 high-dose flu shots, 22 regular flu shots, and 2 kids' flu shots. Health department staff were present and offered Narcan kits and COVID kits to anyone interested. And we did host an employee flu clinic October 15th, so this was this update was pending last month's meeting that wasn't held. So I did not include the stats from the employee clinic, but it was a good turnout.
Good. Okay. Next one.
Correspondence. Continued from September 17th. 2024 show cause hearing, 10 Old County Road, Apartment 2, violations of 105 CMR 410.000, minimum standards of fitness for human habitation.
We are happy to report that this is in compliance, and we have closed the active complaint on this matter. So you may feel free to do the same.
Okay. Now, do we have to vote on this?
Yes.
Okay,
To remove it from the agenda.
all right. Make a motion?
I move to close the complaint regarding 10 Old County Road, Unit Number 2.
Second.
Second? Vote?
Aye.
Aye.
Aye?
Aye.
All right. Permits.
Permit. Kirk Fitzgerald Cranberry LLC DBA The Big Bog Tavern. Where's that gonna be?
That is an event permit.
This an event?
Yep.
Okay, all right.
Yep.
Mirror Melcova Confetti.
That's also an event.
That event. What event is it? Where are these events?
I think one was at the tech school
Okay,
and one was at the 204.
okay.
They just were late getting on the agenda because they were supposed to be on last
Okay.
month's agenda.
Septic installer, Tom Clancy Construction,
And utility installer,
utility installer,
Leonard Avery.
Leonard Avery.
Yep.
Where is
Next page.
Freetown?
Hmm?
Where's Freetown?
It's off Cape
I
somewhere.
don't know, something like that.
I've never heard of it. I just, okay. Okay.
So if there's a motion to approve as printed,
Yes.
I move to accept the new licenses and permits as listed.
Second.
Vote?
Aye.
Aye.
Aye?
Aye.
All right.
2025 meeting schedule.
yep, so this is just a copy of the meeting schedule. If anybody has any conflicts that they're aware of ahead of time.
I was just curious why this one is or bolded or whatever, not bolded, but,
Because there is a holiday that changes it from a Tuesday to a Wednesday.
oh, all right. Okay.
So just for your review, if there's anything that comes up that you know you're not going to be here for, just give us a heads up and we can either work around it or make note that you're not going to be there.
All right.
I know we're all trying to get through 2024. It's hard to think about 2025.
Speaking of which, I don't know if this is the time to bring it up, but as far as December meeting, if you don't have anything,
We're not going to have a meeting.
yeah, and well, we won't know that until,
December 4th.
oh, okay. All right.
Filing deadline, so.
All right,
we
so
should
then
know
you-
early in the month.
All right, then you can let us know.
Yep.
All right. Okay. All right.
Work session. Discussion with David Spitz regarding on the draft housing production plan.
Is he going to be online?
David, are you online? Maybe he was not, maybe he'd not remember.
I was interested on this one, if it was going to be something that I read. Huh. Well, maybe you can do it in January?
Or reach out if you have any questions and want to talk to
Yeah,
him
there was something I had read, I think it came out of Cape Cod Commission, where they were coming up with something where they were going to have standardized not drawings, architectural, whatever, for different types of housing, to make it easier when we're looking at, when people were looking at doing things within the, something to that effect, and I thought maybe that's what he was going to,
If you want, I have David's email, so if you want me to forward that to you.
yeah, to see
you can
if
reach
that's
out.
what he was going to be talking about, because I thought it was interesting.
Mhm.
All right. Okay. And if not, and if that's what he was, regardless, I think it would be interesting to see what he wanted to talk
I
about.
think he wanted to follow up because you had requested when he was here the last time to
Okay.
follow up. So if you have any questions,
All right.
I'm sure it's okay to just
All right.
reach out.
Okay. Then the next one is increase in bedroom count. All right, I'll let you
This is
read
the,
it.
Okay. Continued discussion from September 17th, revisiting the bedroom definition.
So this one's for sewer connections if innovative alternative technology is provided. And I know that the board was interested in some more education about the IA technology. And we're still trying to coordinate that for you to get somebody to come to present to the meeting.
All right.
So if you want to just
Well,
continue that until we have a confirmed,
yeah,
we can get that on the agenda.
all right.
And the next one is what, continued discussion from September 17th, well regulation.
So we also have
Do
the
we do-
bedroom.
The next one was the bedroom count.
Sure.
Or bedroom
Vote on
definition.
continuing that.
You can vote on continuing it, yes, please.
Do we have- yeah.
Yeah.
I move to continue the discussions, both with David Spitz, since he's not here, or do we need to do them separately?
Yeah, you can. do
I
this.
move that it, continue the discussion with David Spitz due to his absence regarding the draft house production plan.
Second. Aye.
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 Aye. I also move to continue the discussion from September 17th about the increase in bedroom count for sewer connections if innovative alternative technology is provided until we can get some further education regarding IA technology.
Second. Aye.
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 Okay. Now we're on to the bedroom definition, if you want to read item C.
Continued discussion from September 17th, revisiting the bedroom definition.
So this is a regulation. If you decide you want to make modifications to it, we have to move it to the agenda. This is just simply deciding if you want to make modifications to the regulation that's currently in place. I know that there was some concerns about a couple of projects that came up to us that had full bathrooms. So whether you want to alter the language or the board, through the regulation, the way it's written, does have the authority to interpret privacy. I think the few that came up, I think there were still some privacy issues versus the bathrooms. The bathrooms just made it feel even more so like living. So I think if you decided that you wanted to have some discretion over what you felt is affording privacy and not, I think you're still entitled to do that in this regulation, the way it's written. I think more so than eliminating bathrooms, half bathrooms, full bathrooms.
Is there any way that it could be worded that would be made more clear?
It's pretty clear.
I think that's, those gray areas can be very tough to be fully inclusive. Privacy elimination, a room that meets the definition of a bedroom may be altered with the following options, including, but you could say, but not limited to, 'cause this
Where are you?
says on the back.
I got you. It's-
So this says included but limited to, so if you wanted to alter that language, that gives you a little bit more flexibility to define privacy.
elimination.
Do we want to do that?
I think it gives us the availability to address it on a one-to-one basis ultimately.
For those weird ones.
And I
that-
think it
Like-
also makes
like-
it clear for somebody that's looking at it. Makes it clear.
I think the one we had where it was like the closed off railing and we had it switched to, I think that's a perfect example of it, where, you know, it really just needed a little bit of fine discretion.
Tweaking.
And reading, I think approving that with, including not limited to, would allow us that freedom in the future.
So do we
Be
want,
okay with it.
let's bring this back in
So if the board would
January.
like, we can get this on a agenda and post it in the Chronicle for January to discuss the change in language.
Yeah,
You don't have to vote on anything at that meeting, but it would give you the opportunity to start those discussions openly and with the public.
yeah, I think that might make it easier in the future.
Yeah, I mean, it hones in on what we're really looking at, but for those really slightly fine-tuned ones, and, you know, came to an easy agreement with the homeowner, so, and it was approved, so
Yeah.
I think,
Yeah,
that's a great addition.
yeah, yeah.
So we move to continue that until the wording is adjusted?
So you will vote to put this on an agenda item for revisions of a regulation. So that would be the motion.
And then we have to have a public hearing.
We'll have to have a public hearing, we'll have to post it in the Chronicle that the hearing's gonna be held because it is a regulation. There's extra notification steps that we have to
Do we
take.
want to really do that in January? Since we don't know the weather, or do we want to?
You can put it off as long as you.
Well, I'm just wondering, do we want to discuss it in January, or do we just want to try to have a public hearing in January?
Well, we're gonna have our regular hearing in January.
So that we would know how we want to word it?
Yeah, yep, so we'll have the language from the last time we did this.
All right.
We'll do it the same language
All right.
on the agenda and the same art.
All right,
posting. We'll just revise current regulation versus adopt.
all right.
So we can do it in January, we can hold off till February, you can have a special meeting outside of your traditional schedule just for this, if you,
Let's do it in January.
All right,
Get it done.
all right,
January's gonna be a big meeting.
All right.
all right.
Cold out anyway.
Okay,
It'll be a good one, though, we got some good education, I think, coming to you in
All right.
January too, so.
all right.
Okay, continued discussion from September 17th, 2024, well regulations.
You wanna make a motion on the last one?
Oh,
So we need to, move it to make it an agenda
Agenda item,
item in January.
yep.
I move to make a revision of the Harwich Board of Health bedroom definition to include privacy elimination. A room that meets the definition of a bedroom may be altered with the following options, including but not limited to, will be the slight revision. I move to make that an agenda item at the January Board of Health meeting.
Second it. Aye.
Aye?
aye,
So at that, once we put it on the agenda, that's when it will open up for whatever modifications you wanna make to it.
okay.
So we'll include the not in January. We'll discuss that.
So I'll give you a copy of the original and proposed.
The lights out of here?
Lights out.
Oh,
Can you stand up? Are they motion activated?
I motion we put the lights on.
The hell?
There we go.
There we go.
all right.
What a meeting.
Everybody bust out your phones and sing Kumbaya. Don't worry, you'll be fine.
Okay, now you can move on to the final.
All right. Continued discussion from September 17th, well regulations.
So again, this would be one, if you are interested in revising the existing regulations, we would need to make a motion to put this on for a meeting.
How many how many wells are there in Harwich? That are actively, I mean, not just for gardens and stuff like this, but people just using it for their main,
Less than 100,
less than 100?
more than 50?
Okay.
Weren't we going to do something with this that to make recommendations. We weren't going to require it, but make recommendations for testing, and this was going to address the PFAS.
This could use some revisions.
Yeah.
So if the board wanted to move this, you could do it January, you could put this one off until February.
I think it's a better idea to put this one into February.
This is no rush.
Mm-hmm.
It's not changing much of anything, but
Yeah.
there are some fees written into these regulations, and then we could discuss at that time whether you wanted to add additional testing requirements.
I think there were some testing requirements and then some suggestions.
Mhm.
Yeah,
Very minor,
yeah.
but to get it, I
Mhm.
think the biggest thing for us was the fees being written and that have changed,
Mm-hmm.
so.
Yes, I think we ought to put off till February.
I move to make the discussion of changing well regulations an agenda item for our February Board of Health meeting.
Second. Aye.
Aye?
Aye.
Aye.
Okay. Can we say anything about him moving?
I would wait.
Okay. All right. All right. Any motion to adjourn?
Motion to adjourn.
Seconded.
Vote?
Aye.
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 Aye, Captain.
All right.